What is the difference between sigmoidoscopy and colonoscopy? Imagine you're trying to get a good look inside your large intestine to check for issues like polyps or signs of cancer. There are two main ways doctors do this: sigmoidoscopy and colonoscopy. They both use a flexible tube with a camera, but they differ quite a bit in how much of your colon they examine and how they do it. A colonoscopy looks at the entire length of your colon, which is about 5 feet long. This means the doctor can see from the rectum all the way through the entire colon, including the sigmoid, descending, transverse, and ascending parts. Because it covers so much ground, it's considered the most thorough screening for colon health and colorectal cancer prevention. During a colonoscopy, patients usually need to prepare by following a special diet and taking laxatives to clean out the colon completely. Sedation is often used, so patients are usually asleep during the procedure and need someone to drive them home afterward. Colonoscopies are generally recommended every 10 years for adults, starting at age 45 if they are at average risk. In contrast, a sigmoidoscopy only examines the lower part of the colon, mainly the sigmoid colon and the rectum. This is roughly the lower third of the large intestine. Because it looks at a smaller area, the prep is simpler, often just an enema or mild laxatives, and it usually doesn't require sedation. The procedure itself is quicker and tends to be more comfortable for some people. Sigmoidoscopies are often used to investigate symptoms like rectal bleeding or diarrhea, and are sometimes done every 5 years as part of screening, but they are not as comprehensive as colonoscopies. The main difference in their capabilities is that colonoscopy allows doctors to see and remove polyps or abnormal tissue throughout the entire colon, which helps prevent colorectal cancer. If something abnormal is found during a sigmoidoscopy, a follow-up colonoscopy is usually needed to check the upper parts of the colon. Because colonoscopy covers the whole colon, it offers a higher chance of catching issues early and reducing the risk of colorectal cancer. However, sigmoidoscopy can be a good option for people who want a quicker, less invasive test or cannot tolerate full bowel prep or sedation. In summary, colonoscopy is the more comprehensive and widely used screening method because it examines the entire colon and can remove polyps during the same procedure. Sigmoidoscopy is less invasive, easier to prepare for, and focuses only on the lower part of the colon. Both tests have their roles in colon health management, but for the most complete screening and prevention, colonoscopy is generally preferred. Always consult with a healthcare professional to determine which test is best suited for your individual health needs.